I'm Tim Bradner. Welcome to Capitol Views. State Budget Director Pat Pitney is with us today. Pat, you've been spending a lot of time on the fourth floor, fifth floor, before the finance committees talking about the state budget. One of the things that I've heard you talk about is the problem of medical costs and state healthcare costs. What that's costing us, what efforts we're doing to try to control the increases. You could talk a little bit. I mean, one question is how many Alaskans are covered directly or indirectly by the state?
We figure about 340,000 Alaskans are directly or indirectly covered through the state budget, and it's about $1.4 billion annually that comes through the state budget, and that's money that goes out to school districts and provides health insurance for school teachers and their families. It's money that goes through the Medicaid program that provides health care for low income. It also helps or provides health care for the children on the Denali Kid Care, and then of course state employees and state retirees. Every year there's a contribution, through every dollar of payroll there's a contribution into the retirement system. Some of that is directed for retiree health care as well. So altogether we're looking at 340,000 lives that are covered.
You know, that's an amazing number. I mean, what percentage of the state's population is that?
Well, it's just under half. You have just over 730,000 people that live in Alaska. And so it's 340, so maybe 40%.
Yeah, it's just amazing. And how many of that would be children?
I believe it's about 90,000 children are on the Denali Kid Care or on the Medicaid program.
And that's for children of low-income families?
Yeah.
Yeah. Is that the one that's in danger of being cut off?
It's not in danger of being cut off. It's in danger of losing a higher subsidy. So our Medicaid subsidy is 50% for traditional Medicaid. The Children's Health Insurance Program is about 88%
Really?
by the federal government. And the Medicaid expansion is over 90% funded by the federal government.
But it's still amazing that such a high percentage of our population is directly or indirectly impacted by this. Pat, what is we've seen steady increases in the health cost of the program. I've heard you say 5.5% a year.
On average, I mean, different programs are going up at different levels, but on average, when you compare health insurance in school districts, health insurance at the university, health insurance at the state, Medicaid costs, on average it's just over 5% annual increases. We have targeted annual increases from here forward at 2.25%, which is what we're expecting inflation to be. And that's going to take a lot of effort and focus. And the administration has four kind of major things they're working on right now. First is the Medicaid reform. So not last session, but the session before, the House and Senate passed a major Medicaid reform bill.
Senate Bill 74.
74. And many of those programs have been implemented, and we're just now seeing some of the cost savings from those programs. The other thing that part of SB 74 was to look at these healthcare authority feasibility study. So the feasibility studies have been done. There's been some good findings and possibilities. We're now talking with other public employers to find out what would make a healthcare authority workable for all parties. How do we get everybody on board, and what can we learn from different healthcare programs for public employees?
And Pat, as I recall, the central part of the healthcare authority idea is to group everybody. We have many different kinds of health plans administered by the state, to try to get everybody together in a few or one plan to save costs.
Correct. Like maybe there's 3 choices of plans, but have all public employers come together and weigh in on 3 different plans, but then you have the consolidated purchasing power. You'd have instead of having 100 different systems, you'd have one system, one payer, to bring that together. And the start would be looking at public employers versus looking at Medicaid, and then over time, see how can you look at the two together.
Yeah. And Pat, the target of bringing in the increases from 5.25% to 2 point, I mean, that's cutting it in half, the increases. That's going to take some doing.
It does take some doing. One particular savings effort we've done this year will return $25 million this year and $50 million next year, and it's having the Medicare program cover more of the pharmacy costs of our retirees. So the retiree doesn't have to do anything, but behind the scenes, there's this employee group waiver program, and the retirement system with Medicare, the federal government will pick up more of that pharmacy cost. But it's something that's done not at the counter for a retiree, but behind the scenes in the system. And that alone, 2 years from now, would be a $15 million savings to the state.
Yeah, these things all add up. Any other examples of savings we could?
We do believe that the Medicaid enrollment has been increasing at a faster pace because of the recession. To the degree that we can put more Alaskans to work, we believe we can find some cost savings in the Medicaid program by bringing that enrollment level down. And then again, the healthcare authority, anywhere from 10 to 30 million in the short run, if we are able to implement steps towards a healthcare authority.
Well, these are some of the biggest challenges we face. And Pat, I want to thank you for coming with us today, and it's very interesting. Good luck with it.
Thank you.
Thank you, Pat. This is Tim Bradner. Thank you for joining us, Capitol News.